Everybody. Today is Tuesday, the 14th, and we will, this is welcome to our staff meeting or our workshop, whatever we're calling it. Hand it over to manager.
All right, thanks, Chairman. Good morning, Commission. With three items this morning, two that'll be, I think, relatively brief, and one that'll take just a bit. We'll talk about the solar panel town hall coming up, and I think Kirk wants to just address a few legal issues regarding that. Tanya has the updated legislative platform that we can take a look at. We'd like to vote on that December 6th. So time is get that cleaned up to where we can get that into a final production. And then Chief Lannerman is here with some staff, and we'll talk about EMS operations and grow your own program and some other challenges that they're facing. We'll just get an overview from them. So we'll take it in that order. So Kevin or Kirk, right?
Morning, Kirk.
Morning, Chairman and Commissioners. Kirk Sponsel, Deputy County Counselor. So I'm here today because I reflected upon the prior communications we had concerning the solar town hall last week, and I just wanted to clarify some of my prior comments. They may have been a little bit too indirect previously. So first and foremost, I just wanted to indicate that the solar moratorium, any potential considerations of changes to commercial solar regulations in the UZC would be considered legislative actions, not quasi-judicial in nature. This is because we're looking at the impact on the county as a whole and more of a policy consideration. The board's actions become more quasi-judicial in nature when they're focused on specific tracts or specific properties. So that's the distinguishment. As such, for the present purpose of potential changes to the commercial solar regulations, just general conversations with the public or with interested individuals would not be considered ex parte communications for the purpose of notices and hearings, things of that nature. However, if a person were to discuss a specific project or application with you, for example, at the town hall, that specific communication might be considered ex parte for the purposes of any future application submitted in that regard. Due process considerations would need to be given to any such future application. So in summary, there is no restriction on you all discussing the general solar considerations at the town hall. With that said, it is within your discretion if you want to narrow the scope of your discussions or direct people to the MAPD, depending on if you think that would be a more effective or a better practice.
Right.
That's all I have.
Yeah, go ahead.
Thanks, Coach. I appreciate that. A couple questions. From what I understand, when the doors initially open, there's going to be tables or something, or charts or something hanging on the walls. So how's the whole thing going to run? I don't understand what the process is. Is someone emceeing this? Who are the speakers? I just don't know what the whole process is.
And I believe, Tanya, do you have the specifics on that, or I can take it back if needed?
Sure. Commissioner, I think how the evening will run is when the event starts, on half of the room, we'll have foam boards up in different stations where the public can come and get some information at each particular station. And then I'm trying to remember exactly what time. Do you have that time, Nicole? At a particular time is when they'll have a panel discussion, and each person will run through, here's some information. So Scott will provide some information. Susan Erlenwine will provide some information. I think there's 3 or 4 speakers. Then they will open it up to the public, and we'll have mics where the public can answer some questions. Once they've gone through any public Q&A, they will go back to the stations, and then any other questions that they have for each particular station, they can ask that. And during that, during the entire time, the public can provide any comments that they have also via comment cards. So there's kind of a series of timeframes through each event or through the entire evening where the public can provide comments in different manners.
Okay. So what's going to be on these foam boards? Because we're not looking at specific projects here. We're looking at the zoning regulations as they stand. So Are there going to be golden rules? Are there going to be different rules that we have in place today? I'm just confused.
Yeah, Commissioners, speaking directly on these stations, just for example, a couple of them that I know were specifically referenced by Scott Wadle. I can't list all of them, but examples are aesthetics would be one. Another might be environmental impacts. So really key components of potential interest and consideration. Lynn, did you have something to add on that?
I was just going to note, each station is set up so that it covers different aspects such as zoning, transportation, environmental, and then the foam boards that are going to be up at each of those stations is going to be the regulation, that the current regulation that is affecting transportation, zoning, access, things like that. And then it basically is put into a question of, do you feel this is adequate or should be modified in any way, kind of posting the question for people to then go ahead and write down what they think is either satisfactory or needs to be changed with that current regulation. And that'll be the same at every station.
Let's Scott's wanting to talk to. He's on Zoom here. Scott, go ahead and fill in whatever you can from Commissioner Dennis's question.
Yeah, I think everyone's covered it really well in terms of the topic parts, in terms of the boards and what's on the board. So I'll stand for any additional questions.
No, I appreciate it. I just don't want this to degenerate into some kind of battle between potential developer and the community. I want this to be an informative method to get the word out to the community that if there are changes we have to make in our regulations, that we're listening to them. But I want it to stay very professional and non-combative.
Thanks again for updating us and reminding us of our roles that we play. Thank you. Okay. Next.
Okay, legislative platform.
Good morning, Chairman and Commissioners. Just want to go through the legislative platform another time here. This is our third draft. And so the last time we had Jessica and Jason here, and I think that I have captured all of the edits and changes. I'm happy to go through each of those changes if you would like me to, or just kind of highlight an overview of what those changes are in each section. You just let me know how you want me to go through this. As the manager mentioned, we'd like to adopt this on December 6th if we think we're headed there. And then I think the other piece that we wanted to talk through was, I think at the last meeting, there was a discussion on how you wanted to incorporate having a discussion with the South Central delegation before adoption. And so just wanted to open that piece up for discussion. So please let me know how you want me to handle going through this. If you want me to go through each individual item as it has been changed, or how you want me to
Well, is
speak to
the
this.
yeah, thanks, Tanya. Is the italics, is that the changes?
No,
or is there-
the italics is what I try to do was kind of.
Can you note where the changes are?
Sure. The italics, just for your information, is where I tried to highlight where we're kind of referencing a state association under a department. So, for example, the first item, and that is one item that I did change under ComCare appropriations. So what I did was I kind of did a combination of that particular item under ComCare. So it reads support community mental health centers of Kansas, and that is the state association for ComCare. Request for workforce initiatives, stable and sustainable funding for 988, and the needs of the uninsured and underinsured. So I kind of took those three items, put them together in one sentence there for the legislative item. And then the second bullet there, I changed that Tim helped me change that. So it now reads, identify, implement, and fund a new state program to reduce the number of uninsured Kansans, particularly those living at 200% of poverty or below.
Okay, that's worded nicely.
Okay, then I'll just kind of move on and state what I've made changes here. Under CDDO, Community Developmental Disability Organization, We just took all of those and moved those there. So it's now under appropriations as requested by Commissioner Dennis. Under corrections, we had something that referred to the state association and we took that out per Commissioner Howell's request. So now it just reads, support the Secretary of KDOC's request to add 5 million to the state fiscal year 2024 budget for community corrections. That's the change that I made there.
Okay.
And then
Is that 5 million? But is that new money? Or is that just, we're just asking for them to add in 5 million, you know,
So
on community corrections? Okay.
It's not my request. I just simply wanted to have some clarity on.
Okay.
Yeah.
Not to send
Referring
the
to the
wrong
state
message on what we're
association.
asking for.
Okay. All right. Thanks.
Okay, under human resources, so the third page there, what I added on the second bullet point, it was amend KSA 74-4914 for exception to the CAPERS penalty for any retiree being hired. And then we added this language into a CAPERS covered position. So that language was added there. Under MABCD, Senate Bill 52, 2021, I think we changed the word to extend sunset provisions there. And then those are the changes that we made from the last revision.
Yeah, well, I applaud the work that we're doing. We kind of seem to be ahead of the game on between the chamber and I understand the city of Wichita with their elections. There's a delay in what they want to do. So I just somehow I want to stay in parallel with so we're not zigging when the other chamber and the city they all have their own interests. I know that are separate, but I'm a little cautious that we're going to adopt ours on December 6th, and I'm not sure that we know anything about the rest of them, but I guess we could always amend later. Okay. Yeah, go ahead.
This is just me being maybe an over editor here, but let me give you an example. Like, for example, juvenile corrections, it says support amending 228. I just think you could just say amend Senate Bill 228. You don't need the word support. In other words, if someone else doesn't write the bill, let's write the bill. I don't want to assume someone else is going to write the bill. So again, what I would suggest is amend Senate Bill 220. It's just one example. The one right below that, rather than saying support amending the juvenile offender code, I'd say amend the juvenile offender code. So it's just cleaner, and it is not saying we're just standing in the background supporting if it happens. I'm saying make it happen, and it's more active. And there's a few others on there. For example, under human resources, CAPERS 3, support efforts to provide a better. I just simply say provide a better option. I wouldn't use the word support efforts. And then some of these are pretty crisp as is. Under MABCD, it's great. It says extend sunset provisions. That's good as is. Top of the page, it says amend Senate Bill 13 to allow. That's very good because it actually is very crisp. And a couple of other tweaks here.
Following that line, under property tax, it'd be the same way, right? Top of the last page.
Yeah, and yes, I agree. I didn't have time to get through all these, but you see, I don't know if that makes any sense. Rather than adding extra words that says support, if it's something if we don't know who's doing it, then I want to lead and say we're gonna do what we can to make it happen. If somebody else is requesting it, and some of these that say support, for example, on the front page, community developmental disability organization says support their request. It has that four bullets at the bottom is supporting someone else's requests. Again, not that I don't agree with these. I would like to make it really clear that some of these things we're going to lead on and we're going to push forward, because if the bill's not being written by somebody else, we're going to make it happen. And some of these somebody says when they make their request, we support them. So there's quite a few of these. At the top of the page, there's support community mental health centers, their request for workforce initiatives. So we're supporting them. And then the next three are actually
Chris, let's say identify, increase, and provide. Those are three active words. So they're actually pretty well worded, but that top one is about it's a support statement. So I don't know if we ought to put support statements together someplace and say, these are we agree with these requests from other people, just to kind of reprioritize this. But not that those aren't important, but again, support statements maybe could be collected together. And whereas the active statements that we're asking something to happen, that they could, again, I'm not suggesting we rewrite the whole thing here, but to me, it would be a better format if we would consider some of that. So overall, it's pretty good. I agree with the changes you've made so far. Thank you.
Yeah, I might have missed this, but two questions. One, do we know when City of Wichita or the Chamber is doing their legislative platform? In years past, has there been a collaborative effort to see what's on there? Is that a way we can collaborate those? I might have missed that conversation.
Yeah, the chairman's statements are germane for two reasons. That's number one. What do we do with the joint platform? And if the city's not prepared, and if the chamber's not prepared, I'm not sure how that discussion is going to happen. But to answer your question, yes, every year we have some discussion about joint platform. And then secondly, and I think Tanya wants to go here, we want to talk about how we engage our South Central.
That's my second point. It's actually refreshing to know that we've had legislators approach us to say, hey, could we talk about coming in the room and having a conversation about it? Is that something we do in this room? Is that something a bigger level, or what do you propose? And maybe Commissioner Howe might be able to help us on timing. I don't know what their calendar looks like and when that would be most effective for them, but I think it would be a helpful session to sit down and talk through this with them so they know specifics.
Well, and I just go back to what Jason mentioned at the last meeting that, it would be helpful to meet with South Central delegation. I think it's a matter of how the commission wants to engage the South Central delegation, if it's something in this room or with a smaller group. So I leave that kind of up to the commission on how you want to do that. I did just check with Jason on, when he would like to see our adopted platform for their purposes to get it up to the legislators. And he did say, if we could get it adopted by early December. So I just give that information, to the commissioners.
Well, I'm open for considerations on how we do this with South Central delegation. I think it's an important thing, an important aspect that I think would be more engaging for them to get in the room and talk through these things. But I'm open to the format and what that looks like.
To answer Commissioner Sadie's question, every year we get together with the entire South Central delegation out at WSU, and we all speak to the South Central delegation on our legislative platform. So I think that's probably the same way we'll do it again this year, unless there's some change.
Do we know if that's going to happen this year?
I have not heard anything about that. And I think the question, that is historically how we've done it. I think the question is, do you want to? Our platform is cooked by that time. It is done. I think the question is, do you want to engage them before it is done?
Before it's adopted.
Yeah.
And let me also say that the week from New Year's Day till the first day of session is a horrible week to try to meet with these folks. They are all getting ready to go. They're doing last minute things in the community, and they have an abundance of meetings. It's extremely hard for them to do that. And for us to expect them to spend basically most of a day at WSU. Again, they usually have one community forum sometime. Usually seems like that seems to happen around that same time frame. It's just hard on their schedule. If we want to reach out to them and have their input on this, obviously it needs to happen before Christmas. So again, if we can kind of hone in on our platform between now and the 6th, and say on the 6th we kind of finalize this thing, it gives us about 2.5 weeks for us to engage some type of a interface with the legislators. And again, if you host them with, some, can't be all work and can't be too long, but if you do it the right way, I think you'll see some good support there. And even if some of them step in and provide some feedback, it probably would be very useful. So I think our best chance may be in December. And I will just tell you this, no offense to anybody, but I think that January event where we stand in front of the legislature, it's been poorly attended by them. No offense to them. And again, I know they're busy and it's extremely boring. And my opinion is it doesn't do a whole lot to move our ball forward. So that's probably not the best strategy for us to lean on that, saying that's how we're going to talk to these folks about our platform. It just doesn't work. And the other thing is they're also getting platforms for everybody else at the same time. So I would really target something between the 6th and probably the 20th of December.
And speaking on, I think REAP has been the one that's coordinated that in the past. And Keith has taken a different approach to, he understands exactly what you're saying, Commissioner. And I think they were changing that format drastically around to be more of a, almost each entity would be at a table and they can kind of come around and engage with the city or the county or the other members of REAP or something like that. But they want to change it. He's got a draft of how he wants to do it, but I can share that as soon as he gets with us. But it'll either not happen or it'll happen differently.
I was just going to say that it seems to be the format that I've heard about. They're talking about an informal opportunity for people to interface at tables, that we would be at a table and they would come to us and ask questions. We would talk to them as they have opportunity, but it might be a bit of a longer event for us, but it'd be more personal. And again, I'm not sure the details have been worked out yet, but I do think it's going to be much different than we've seen in the past.
I just want to make sure that I'm following. So if we have what we want done by December 6th, are we saying that we want to wait until we have something closer to Christmas? Because if we do that, then if we get this to Jason and Jessica at the end of December, beginning of January, does that make it harder to get any of the things that we're wanting passed because they have less time to work that? I mean, I'm assuming that there's a reason he asked for it by the beginning of December, and I just want to make sure that we don't jeopardize anything in the timeline as well. And I think the ideas are great, but I want to be careful with that too.
I think he's wanting it by early December, just so he can have it and able to give that to the legislator prior to the start of the session.
I think so. We just need to be aware and maybe have to be flexible if something pops up. But if we adopt ours on the 6th, give it to Jason, they can, Jessica, they can roll with it, and then we can just
Okay. Yeah. No, that's helpful.
Right.
I just want to make sure that we weren't going to mess
Right.
anything.
No, we're not delaying. I'm just threw that out there because others are being very delayed. But okay.
I think that once we agree on it, I think we could actually consider it something that might have some minor edits once we do have an opportunity to speak with those folks. Jason could look at this as a working copy, a draft from the commission that we would like to get their input on. But by the end of December, we got to go to print. So again, if we have a chance to meet with these folks, give them, if you will, a editable draft copy, non-printed, say, here's kind of where we're at. And we can talk to those folks and then make some changes if we feel like it's needed. And then go to print so that when he gets to the session, he's got copies to hand out in the elevator type of thing.
And that won't make it confusing if we go to a legislator with a draft copy and say, this is what it is. And then we print something off and it's different. I mean, I just want to make sure that that's not going to seem odd. I guess I don't know the right word to say, but if we give them something and then change it later, does that make it seem like it's not
maybe draft's not
priority?
right.
I guess I just want to make sure I understand what we're doing.
Maybe draft's not the right word. Again, I just simply say if the commission believes this is where we're at right now, pending, if you will, some opportunities to discuss with legislators. If something comes up as being maybe word something better or take something off or add something to it, minor changes potentially that might happen. I don't know that it's confusing necessarily as long as they understand, or withholding printing simply because we want to hear from them. And again, I think once we go to print, it's done. But even after we go to print, there's still things that pop up in the session, and we always have the right to adjust our focus of priorities during the session as things come up. And I think everyone understands that process.
We'll talk to Jason, and then if we think we're 90% here with this document, make the final edits this from today, and then we'll talk to Jason and we'll hone in on December. So. Anything else on that, Chairman? On this, okay, Chief, you're up on EMS discussion.
Good morning, Chairman and Commissioners. I just wanted to speak about a few things. Couple things about staffing, deployment options, and then vehicles and equipment. They kind of go hand in hand. We had a staff meeting or a town hall meetings last week with staff and kind of presented some options, some ideas that we've kind of been about trying to get more resources, more trucks during the high demand call volume time. As most of you are aware, there's times during the day where it's status. We have 2, 3, 1 trucks available, sometimes 0. Our staffing is getting better. And I can kind of allude to that here in a little bit, but we need to figure out a way to reallocate resources to meet that call demand. So currently this is our 24-hour temporal ambulance demand plan. We have 14 trucks on until 3 a.m. It goes down to 13 from 3 to 6 or 3 to 9. Then we had 3 trucks at 9, 2 trucks at noon, and then 1 truck at 3 p.m. And then they start going off after their 12-hour shift, where we get back to 14 after midnight till 3 a.m. This heat graph here is a depiction of our last 12 months from November 22 through October 23. This is call demand by hour day. Over on this side is the days of the week, and I hand you all copies of this. Sorry, I should have alluded to that because this is kind of difficult to see up here. And then this row down here is the overall combined temporal demand by hour of the day. As you can see, that 3, 4, 5 o'clock hour is the lowest. The white is the least number of calls, 5 to 6 calls per hour, 90th percentile, up to 17 plus calls per hour in the middle of the day. There's any questions on that map there? So this kind of goes along with this chart that a lot of you have probably seen before, and Commissioner Howell, I think you like that chart to kind of see where our demand is during the day. This is the 90th percentile, this blue here. It mimics that heat graph on the previous slide, where it goes down to 6 or 7 calls per hour here, up to 16 plus in the peak of the day. I don't have the 23 numbers, but the 22 average, that's what the red line is. That's what we were average staffed to in 22. As you can see, those lines are touching almost in a lot of areas. The green solid line is the same line as that first graph that shows where our current target is. If our operation schedule is full, this is where we would staff to this green line. As you can see, there's still not much room when you get in the middle of the day, and there's maybe 2, 3 calls different, or 2 to 3 calls per hour different compared to the resources we have. So it kind of depicts why we're in status event a lot of the times during the day. When you're running that many calls 90% of the time, and you only have that, you only have that many trucks available, you're pretty much living in that status 3 at the most during the day on a normal day. I did throw it in here. This black line was 2022. That was the peak, the max call volume for those days. We had some days we had over 20, 21 calls per hour in those days. So this is what I presented in the town hall meetings. This green line here, this green dotted line, it is an example of what we could do by just reallocating our current resources. And I will preface this with what I prefaced at the town halls. This is not something we could do today, not something we could do all at once, but this is a goal to try to get to eventually. And this is not set in stone. This is, like I told them, this is some of my 3 a.m. thoughts that I've had, that I lay there and think about, that I brought to my staff, and then we presented to our field providers to get feedback from them. And we are actively getting feedback since the town halls, and we want to take into account what their thoughts about this. But the initial feedback from the town halls was very positive. They realized that that we need more resources during these high call volume periods. Not only to meet the demands of the patients, the demands of the facilities and agencies that we have contractual obligations with, but also just for their own well-being. They need some downtime. They need an opportunity to catch up on paperwork. They need an opportunity, hopefully, if you can see the highest time of having units is during the time when we have shift change at 6 o'clock for 10 trucks. Hopefully that will get them off work on time. Hopefully they won't be working 12 or 13, 14, 15-hour shifts. They'll be working their 12-hour shifts more regularly. They'll get off on time, get home, improve their work-life balance. And that, goes along with what all you've done to help with compensation, but that also helps with the retention part of keeping these folks for long periods of time. That's our goal. Any questions on that? I know that's kind of
It's good. It's good information.
So,
Wait.
oh, sorry.
You said if there's any questions, so
Okay, no, you're fine.
let's talk for just a minute. So again, the green line, I believe is a goal based on,
The solid green line.
yeah.
That is where our current target is. When we're staffed to what our operations schedule is now, that's what it is right there. That's how many trucks we have on right now.
And just a note here, but the entire chart, the red line's below the green line.
Yes.
So again, we're not able to staff to the green
That
line.
was where, because having trucks shut down because of staffing issues, things like that, that was the average of last year where we were actually staffed to.
So again, my memory is not the best, but going back to say 2015, 2016, 2017, that timeframe, I remember seeing charts like this where that top line was significantly higher than what the green line shows today.
Yes. A few years ago during the previous administration, we were having difficulty staffing. And so they took Medic 24 and Medic 43 off of the staffing chart, off this operation staffing. And that's why it was at 21 and they lowered it to 19 because they were unable to fill them. So they just took those off of the deployment schedule.
And again, that was a concession we made because of staff challenges.
That was, yes, I believe that, staffing, they couldn't fill them. So they instead of just leaving those trucks open, they just took them off of the operations.
So what it effectively did to make the data look better, but really, it may also say, I believe the call volume has actually increased at the same time frame.
Yeah.
We've seen call volume go up.
Yeah, and I have a chart here in a little bit that will really depict that. So with this this is not only reallocating the current resources, but when we get fully staffed to our 144 FTEs for our field personnel, we have 155 in field operations. One of those FTEs is dedicated to the ICT-1 program. And then we have 10 district chiefs. So we have 144 FTEs still in the field operations. This current schedule here that this green line depicts is 132 FTEs. Because that was when they took that Medic 24, which is a 12-hour truck, and Medic 43, or Medic 24 was a 24-hour truck. And Medic 43 was a 12-hour truck. So there was 12 FTEs that we still have in our staffing table, but aren't represented in our operations deployment plan.
So you're saying the green line needs 100, how many?
132.
132 staff to do the green line. Does that count vacation, sick leave, and that type of stuff?
There is 4 vacation personnel that are assigned in that. There's actually 128 slots on trucks and 4 vacation personnel, 2 on each day shift that's assigned to help with sick, vacation, leave, absences, things like that.
Thank you.
And I will mention with staffing real quick, we on the last weekly ops report, we had 12 openings for field providers. We have one more paramedic that's scheduled to start on the 19th, and then 8 more that will be starting at the end of December, 1st of January, that are graduating paramedic classes. And these are not individuals that are 8 more. So a total of 9 more providers and these are not providers that are affiliated with our EMT to paramedic program. These are additional either that were working part-time for us that are transitioning to full-time, but we're not part of that. And 5 other that will be recent or new graduates of the next class that have applied and want to come here full-time. So if we get that retention part down, like I said, that 12 number by the first of the year should be down to 3. And that's based on the 144 FTEs, not the 132. So with that, without doing anything, we should be able to add, if we get fully staffed at the 144, we should be able to add 3 more 12-hour trucks onto the staffing table during peak times without reallocating any resources. So that leads into the next issue is vehicles and equipment. In order to have this plan or any kind of these options come to fruition, we have to have the equipment and vehicles to put these providers in. You all know we talked about the new vehicle lead time is 36 months, 3 years. If we ordered one, cut a PO today, it's 3 years before we'll see that vehicle. This little backtrack of how we got here. Of course, the semiconductor or chip shortages. They had pandemic related shortages in all the factories that are building ambulances. The recent UAW strike didn't help when we were starting to come out. Then there was further delays. And this article in EMS 1 talks about how that they didn't prioritize building chassis for emergency vehicles over passenger vehicles during that time. So all that kind of led to where we are now with historically before it was 3 to 4 months, 90 to 120 days from the time we cut a PO till we took delivery of an ambulance. And now, like I said, it's 3 years plus, and even our remounts, which is a vital part of what we do to decrease cost and to, of these expensive ambulances, it's still 2 to 3 years now after that order is placed before we can get the remount. It only takes 90 days or so to do the remount, but the backlog of all the manufacturers that are doing remounts is causing this to be about 2 to 3 years.
So Kevin,
Yes, sir.
if I can ask, so finance, so since there is a change in ordering and process, this is something that obviously we'll take into account when we meet in February, when we first get together on stuff.
It absolutely will be, because I'm glad that Kevin's bringing it up here, but this is something the entire organization is facing. Public Works is having challenges. I think we talked earlier this year, maybe late last year, about the sheriff not being able to get any replacement patrol vehicles just because of supply issues. So this is going to have to be something where we as an organization are going to have to step back and rethink kind of how we do this so that we can make sure these folks are getting what they need in a timely fashion.
Yeah, so we'd be making decisions today for 2 or 3 years delivery. In this case or in
I think
Lynn's
depending
case,
on how you all want to have the conversation, yes, you could make decisions today that could impact that, or yes, we can go through a budget process, however the commission wants to handle it.
I think it's complex enough. We ought to drive it through the budget process.
Yeah.
Ordering something and how you pay for it when it takes 3 years to get here is challenging, just from an accounting perspective. So we need to maybe dive into this a little deeper.
So this is that chart that our historical call volume, as you can see, every year, pretty much it goes up. We've had a couple dips, I believe 2016, and then of course last year with the loss of transfers. It's a little bit different than the one you have in your package because we did update the estimated 2023 on the graph up here. So as you can see, although we lost a few calls last year because of the loss of transfers. We are going to surpass and almost get back to 2021 in 1 year. And historically, that's just going to continue every year. I will note on here that we have not expanded our fleet since 2019. We expanded by one. And that at that time, our call volume was 64,000, a little over 64. We'll be close to 70,000 this year. Going all the way back to 2009, we've expanded our fleet by 4 vehicles since 2009, and our call volume in 2009 was about 49,000. So a little about 50 or 20,000 calls more, and we've only expanded our fleet by 4 vehicles in that amount of time. So
That's efficient management.
it is, but it's got us to where we're at now, where we have
Our leadership.
multiple trucks having over 300,000 miles. And by the time our 5 ambulances that you all approved and we ordered back in January of 2022, that won't be delivered till hopefully, I say hopefully December 24, but more likely the beginning of 2025, we'll have a half dozen ambulances with over 300,000 miles, which is not a very good way to do business. You have they're not reliable. Bo's here. You can talk about the fleet costs that go up on trying to repair those ambulances that have that many miles. So, so this is kind of where we're at today to try to see where we can to get budget authority to create the purchase orders for these vehicles. Not only the new and replacement ambulances, the remounts, the operational support vehicles that we need, knowing that this request is not going to be paid out now. It's going to, the request spans 3, maybe 4 budget years, but we can't order these vehicles until we can put a purchase order in. And so the longer we wait to do that, the further behind we're at on vehicles. So real quick in summary, then I'll take some questions. The replacement and remounts, basically 2 ambulances that need replaced, and that's in 2026, projecting out their points. They'll be needed replaced in 2026. There's 9 ambulances. We're in a big period right now of remounts. And like I said, it's 2 to 3 years if we don't get them in line for the remounts. And 2 SUVs. And then we'd also like to have the ability to retain the current vehicles that we have when they're replaced, to increase the fleet and increase our reserve spares. Like I said, knowing that it's not optimal to have vehicles over 300,000 miles, but that's kind of the only option we have right now to have spare vehicles. And the cost of that is about $4 million. And then to fleet expansion, for 6 ambulances, 2 pickups and 2 SUVs, which are needed for not only for our district chiefs, but also if we want to do any kind of mobile integrated health type things, increased our ALS first response. The cost of that's about $3.6 million. With that, any questions?
Yep.
Okay. So your total request is about 7.6 million, but that's we're out of the budget cycle. So is this something you need to do right now, and we come up with $7.6 million, or is this something we're going to put in the 2025 budget?
Well, that's the question for you all to decide. I'm trying to give you the information of what I need. The longer we wait, if we wait till the beginning of 2025 to order them, that's another year on top of that 3 years before we get those vehicles. We actually have 14 trucks that need remounted right now. Bo had budget for 5. Is that correct? That he's able to do now. This would give it the budget authority to get those other 9 in line, so to speak, so they can be remounted within the next 2 to 3 years.
Well, and actually, I need to clarify that. So I think we haven't really had a chance to talk about this with EMS yet, so we have not worked through the details. But what I will tell you is the fleet fund, which is typically responsible for making these purchases, is a certified fund, which means we have to readopt the budget to establish new budget authority. So we have to go through the publication, the public hearing, and all of that. And simply just given the time for this year, we are past that point. So the fleet fund has already been adopted for 2024 as well. And there's simply not enough budget authority available there to make available for this in 23 or 24. What we would have to do is essentially either use cash in the general fund and allow those purchase orders to roll forward from year to year to year, eating up budget authority in your general fund budget, or something that Lorian has suggested, and I think is a very good idea. The commission is aware that we closed out the EMS tax fund and moved it into the general fund. As a part of that, there is a cash balance that has remained in the EMS fund. And we are now planning at the end of this year, and we talked about it during the 2024 budget development, to move that cash out of the EMS tax fund into the general fund, and then move it immediately out of the general fund into our new technology and equipment reserve fund. We had originally planned for that 4.2 million to go toward future replacement of, durable medical equipment and things that we know that EMS will need at some point as a part of a replacement strategy. But one option could be to use the 4 million at least to do the requests for the replacements, and then potentially send the requests for the additions through a 2025 budget process. And that might be something that the commission could consider. I know that I'm getting far more technical with you than I typically do, and I'm sorry for that, but I want you to know why it's not as easy for finance to just flip a switch and make this happen.
Hey, but to bring it down to a different level, okay? What his request is going to be paid out in 3 years. We're not spending out of 2024 or 2023 budget, either one of those.
We're not, but the way it works, and this is an accounting standard for government, is the second you put in an order on a budgetary basis, you've committed that budget authority. You've committed those dollars, you've entered a contract. So it looks like on a budgetary basis, you've made that expense today. Now, you're right, on an accounting basis, doesn't matter until we actually get to where we receive the items and cut a check to the vendor. But that's why this is so complicated. That purchase order sits in the system, eating up budget authority until we actually get the goods. That's why this is so complicated.
All right, well, then a second part of that, back when we decided to start buying 550s for our trucks. At that point in time, actually, Commissioner Howell and I both talked about, why don't we keep some of the ones as spares so that we've got them available? And at that time, we were told, well, we don't have the money in fleet management in order to be able to do that. So this $7.6 million that we're looking at, 6.6, that takes care of that fleet management question we had before on.
So your replacements right now, what we could talk about doing is keeping the current ambulances well past their useful life when they're replaced 3 years from now when the new ones show up. And we could anticipate that in the fleet management budget and give them money for repairs and maintenance and things that currently we don't plan for there to be, because we plan for that vehicle to go away because it's a replacement. So with enough notice, we can plan for that. And if that's something the commission wants to explore, although by that point, having added 3 more years to 300,000 miles, I don't know if it's worth it at that point or not.
Well, we talked about it before and we were told that that wasn't a good idea. So now it's suddenly a good idea because we can't get vehicles.
Yes, it is. The circumstances change, sir.
So that follows on. They're not the only organization that we're going to be facing this with. Public Works is going to be coming up and standing right in front of us saying the exact same thing in the near future with their vehicles. The sheriff's going to be coming up talking about it. So this total that we're hearing today from EMS is just the tip of the iceberg. We're going to see a whole lot more in the future. Is that right?
Absolutely. And I think to Tom's point, that conversation at the retreat in February is going to be necessary because we're having to kind of go back to the drawing board and rethink how we do our fleet system. no one GFOA, our best practice industries have not anticipated these issues before. We're all now grappling with the same issue and how we're going to deal with this, because honestly, government finance isn't set up to deal with this nicely. So we're going to come up with a plan for you and have a
So
comprehensive
this
list.
is just preview.
It is a preview of things to come. Yes. So get excited for February.
Thank you.
Okay.
I would
Yes,
add, I did put a chart that I don't have on here in front of you. A lot of pretty colors, red and blue. That is our spare status daily, where it is now. As you can see, we have about 54% of the time we have 3 or less spares in our reserves. We have 10 spares right now. 2 of them are off getting remounted. 2 trucks are off getting remounted. We have one that's was sent for, it was in an accident, got hit transporting a patient to a hospital a few months ago. And then any given day, we may have 2 or 3 in for preventative maintenance. We had one the other day for radio issues, maybe sent back to Ford for any kind of warranty work, things like that. So the 6, like I said, if we get up to 20, 24, 25 trucks during peak times, you have to have more spares. That's more ambulances to have preventive maintenance. They need to go get remounted. With 30 ambulances, even if we stretch them out to 4 years, which we've been doing, because they get about 70, 80,000 miles a year, that's 300,000 miles plus in 4 years. And, turning over our fleet, that requires 7+ ambulances, either new or remounted every year. So this delay in getting vehicles is really, put us in a bind. So sorry.
If I may, you answered the question on where the funding comes from. I got some questions generally because we're looking at fleet, we're looking at equipment, looking at accessories, we're looking at personnel, obviously with the model that we're moving towards. I want to talk about the EMS budget in general. What percentage is fee generated or grant generated versus what percentage is taxpayer subsidized of the EMS budget? Or what's the budget total that?
So for 2024, since that's the cleanest year, the total EMS budget, sorry, I got to put my glasses on. Getting old is for the birds. Okay, 22.7 million is their total budget. Of that, 17.3 million is estimated to come from charges for services. So that's just at 3/4 of their budget is expected to come from those charges. And then the difference is made up through general fund revenue. So that could be property tax, it could be investment income, it could be motor vehicle taxes. It's all those things that we've talked about where money is fungible in the general fund, but it's 25% subsidized by other funds.
Well, how do we how do we determine the fees for service? What it costs to utilize a transport? What does that come from? Is that an arbitrary number? Is that something based on
based on surrounding agencies like type agencies? We do have a cost of what our break even is. But Brian may be able to speak better to this with the revenue issues. That our published rate, of course, is since 2019, it hasn't changed.
That's set by you all.
And that's set through the BOCC.
Okay.
But most of our patients that we transport they're Medicare, Medicaid. There's a portion that is private insurance that would affect the published rate.
But Medicare, the highest percentage Medicare, Medicaid, that's a fixed rate reimbursement.
Yes.
When was that last addressed?
Actually, Medicaid just increased in the last 2 years to where we are now getting Medicare, the Medicare rate, rural rate for Medicaid also. So that's significantly increased our revenues. Brian's, he just told me yesterday that he's projecting this year that will be about 1.8 million over our projected revenue for this year.
Yeah, I guess my question really, the basis of it was we obviously have some revenue need to generate revenue or subsidize the department in some of these things. And if there was an opportunity there that we need to at least consider. It doesn't sound like that it may move the needle much, our published rate based on the percentage. I'd be curious, you can give me the number separately, but what percentage falls under that category of the published rate versus Medicare and Medicaid?
Good morning, Brian Nicholas, MSW Chief. So we have looked at our rates about a year or so ago. They actually haven't been updated since 2019. And it is safe to say that our rates, our standard user fee rates are lower than many of the others in the industry. You know, we haven't adjusted for quite a while. The limiting factor is that approximately 64% of our billable incidents come from Medicare, Medicaid. And so, you know, you can charge whatever you want, but you're only going to get the Medicare, Medicaid allowable rates. Sure. And as Chief Lanterman mentioned, for years, the Medicaid reimbursement was unbelievably low. However, just last year, you know, the legislative process increased Kansas Medicaid reimbursement to the same level as Medicare rural rates, plus an increase in mileage. That's going to be really good for us. I think we figured roughly 800,000 of extra revenue just because of that legislative change. There's also been some other processing efficiencies in finance as far as obtaining set-off funds and things like that. And so basically, yeah, we've discussed the possibility of recommending a user fee increase. I mean, that's at the will of the commission, if it's the right time to do that and burden the taxpayers with higher rates. But so yes, it could generate more revenue on the portion of payers that do pay at that user fee rates.
Yeah, certainly don't want to burden people on their worst day.
Right.
But the cost that is being bear by the entire community also is something that needs to be considered as well. So I don't know if I guess I'll lean into your recommendation if that's a consideration that we need to be having. But I'm just trying to generate, how do we meet that gap to where we do all the things that's needed, but we're not, this budget isn't going to soar in a way to where it's going to have to offset some other things in the general fund. So,
well, I think in the past, the way this has been addressed is through a revenue package that's submitted by EMS. So I think that's something that we could look at for the 2025 process, is potentially what that could look like and what it would generate if that works for EMS. I think that's certainly a strategy we could do.
absolutely.
You said it's been a while since you've looked at that. When was the last time that you just?
The
2019.
2019 was the last time that the user fee rate was increased.
And what about surrounding services? I mean, how often are they adjusting?
I don't know
Do you know?
exactly
I mean-
when. I just know if you look at different municipalities around us, like size, we are behind. We are lower than some of those agencies. But like Brian said, we could charge, as much as we want. We just need to figure out, if that's really going to increase revenue for those percentage of people that pay the published rate. So,
just for clarity, of those transports that those folks that you transport, do you know what the percentage is that are uninsured we receive no payment from? Roughly.
I don't have the total number. I know that our collection percentage from the uninsured is like 4% as opposed to 90+% for Medicare, Medicaid. So
In private insurance, not all of them pay the full published rate. They pay their allowable, and the copay goes to their constituent, their customer.
correct. I mean, it depends on the multiple different types of policies out there, but the insurance company will pay a percentage, and then the balance, copays, deductibles, things like that, obviously are billed directly to the patient. And the collection, I don't know the number off the top of my head, but the collection rate is definitely lower for that. But I could get those information.
Another issue with compensation for emergency medical services pre-hospital is that you may treat patients in place, but if you don't put them in the ambulance and take them to an emergency room, there's no means by which to receive compensation for that medical care that's provided.
at this point, that is correct.
And there are efforts to try to generate
change
that type of revenue, but it's a legislative issue largely.
I was going to make the same point. That's and we also do have costs, not just personnel and depreciation on vehicles and fuel charge. We actually spend money on supplies. We doctor people up and they'll leave them there. So there's other costs involved in that as well. I'd like to ask a question to Lindsay. So regarding some of the rules that you have to follow and how we fund this thing, can we conceive a legislative solution that would give us some relief?
Unfortunately, this is not a Kansas state law issue. This is truly the Governmental Accounting Standards Board sets and defines those gap principles that Hope talks about when we present audits. There is no flexibility around that. The only flexibility is if we can conceive of ways to do something within our system that would allow us to put in a purchase order for the proper price, but then potentially eliminate the impact to the budget until it is actually arrived. And I have no idea if that's something we can do or not, but we're moving to a new financial system in the foreseeable future. So potentially that's something Mike Helpers' team can help us look at to see if there's brilliant ideas out there.
So today, when we have a status 3, 2, 1, or even 0, typically speaking, we still have equipment in storage or not being utilized at that time. This is a staff problem more than an equipment problem. Is that correct?
It's a combination. It's just a combination of staffing possibly. And like I said, those times that we're shutting down trucks are getting less. But it's a call volume issue too. There's days that we're fully staffed, that we have every, truck that's on the staffing table staffed. We've had days where we've had extra people that we actually added another truck because we had people that could work and we put them out on the truck and we were still down at status.
What I'm saying is the green line on that chart, that's our goal. And I don't think the green line is where we would be if we had staff and equipment. We probably wouldn't make that line where it is. That's more of a concession. That's more saying based on what we have today, that's our goal to that, right now, but it's more of a concession. Anyway, so with that in mind, if we had more staff and more vehicles, that line would be higher. As my point is, you said we might even find some folks that are willing to pick up a shift or whatever. There's a vehicle for them to use if that was to happen.
Yes.
We don't actually say we have got people and no ambulance available for these people to go out and
there's times when we have no spares available.
So we actually have
a chart where we're down 3, 2, 1, and then if something breaks down, that it gets even less than that during a shift during a day. I mean, that's fluid because obviously things can break down during the day or things happen, but there might be times when we have absolutely no vehicles for them to go into. And that's my fear of, increasing staffing, is that there might be times when I have people available and no vehicles to put them in.
So let me be very clear. I'm very supportive of increasing our fleet to whatever is needed. And I'm not going to, again, if you ask the people in the community or even ask any elected official, public safety is number one. If you ask people, do you want less fire stations, less firefighters, less police, less paramedics? The answer is always going to be no. They want us to do it right. And again, I would argue that our staff is going from call to call to call. I think they're fatigued. This is it is a retention challenge because if they're never able to catch their breath, I think that they would rather work someplace else. And so I think this is an issue of retention. We're overworking our folks. I think that they have to do the paperwork many times at the end of their shift, stay over to do that. And I think our response times, no offense to anybody, I think our response times are not what they could be or should be because we are struggling with a fleet, but even more so a staff shortage. And so with that in mind, looking at your goal of going to 25 at the high end of the day here, how many paramedics does it take to go through an XO shift 24 hours, say 48 hours over a couple of days, whatever? How many paramedics does it take to staff us to the dash green line, and then add in a few more people for vacation, sick leave, that type of thing? So how many paramedics do we actually have to have? And by the way, if you paired a paramedic, qualified paramedic that can go independently with I think it's better to have 2 paramedics. But in the short term, if we had an EMT coupled with a paramedic that can do that, do we have enough paramedics to in fact fill all the teams we need? Not EMTs right now. I'm just talking about paramedics. How many paramedics does it take if they were paired with an EMT to do that dash green line?
It would be, well, if we had 144, I mean, it would be half of that, but you can't have half because we have some paramedics that are on probation that they can't be lead medics yet, things like that. Which we have at the time I did this had 14 probationary paramedics. We had 85 lieutenants, captains, and paramedics that could be lead medics.
So we have lead medics around, you said 80 or 85, something like that. So again, I think as a interim solution here, EMTs are easier to find. And I'm not suggesting we do this permanently. I'm simply saying when we're short of paramedics, we ought to be willing to hire EMTs to fill those teams so we can have the response and the trucks on the street. And again, as we find paramedics, we will attrition, if you will, and transition to paramedic teams. But in the short term, when we're short of paramedics, we need to have EMTs to fill that. Again, so having enough vehicles and having enough EMTs, so these lead medic paramedics can go out independently to provide the response the community wants, is a goal of mine. I don't know if I'm saying that clear enough. I don't know if anybody else.
You have said it clear, and I understand. And we just had a hiring process a few weeks ago where we hired strictly EMTs, as many as we could, and we had 6.
And again, so let me just say,
that's how many we hired. We had 6 qualified that we hired, and we just lost an EMT to a different line of work. So we just net of 5, and that was hiring as many as we could to be available. I told them if you had at that point we had 18 open positions on our staffing table. I said if you got 18, we'll hire 18, and we got 6, and part of that is because the EMT pay is 15 something an hour.
So we maybe look at that as a reason why we're having trouble here. But again, even if having 5 or 6 is a huge step in the right direction, and again, trying to hire 5 or 6 paramedics may be impossible. But you can do this as a way to get some more teams on the street and reduce our response times and get this status away from that.
Like I said,
that
by
red
the first
status.
of the year, we should be down 3 positions total if we don't lose anybody. At the 144, we should be at 141. So we should be almost flush to that 140.
And I think our strategy ought to be anytime we're low on paramedics, we ought to be willing to fill the shortage of people with EMTs, again, not permanently, but again, through attrition and transition, our goal is paramedic teams. But again, as a way to not be short on the street, is
to get as many resources on the streets as possible to alleviate some of the burden. That does increase the burden a lot of time on those paramedics, because even if it's a low acuity call, they still have to be the one to do the initial assessment, find out what's going on, make sure the documentation is done right, because ultimately they're in charge of that vehicle. So it does increase their job a little bit, but having those extra resources out there to where they're running maybe 6-7 calls a day instead of 10-11 calls a day, I agree would be very helpful. So.
I'm not seeing any data today regarding how many ambulances do we actually own. And we know we might have as many as 19 active at one moment, and it maybe have some standing by because one might break down. So probably have, maybe several more that are active status, but maybe not running the streets. How many ambulances do we have in our fleet, and how many of them are in storage versus being, something's being done to them? And can we see some type of a status of overall fleet would be?
We put that out every evening of how many trucks are down and what they're down for. We can include you on that.
I don't use it all the time. I just like
I said, this chart here pretty much depicts on a daily basis up until I believe yesterday how many spare trucks we had in spare status that are available to be put out in service.
Okay, and then again, I do think that since we've added nearly 20,000 calls per year. And you said you added 4 to our fleet.
Since 2009, we've added 4. And last time was in 2019. We added 1 truck in 2019.
The 4 includes the one in 19?
Yes.
So we've added 4 vehicles. Again, it might be nice to know how many we actually have. So
calls.
See, does that make sense or not? But anecdotally, again, not that we chose this, but our staff numbers have actually gone down a little bit. Our call volume has gone up, and our fleet numbers have gone up some. I don't like the staff thing. I think
our staffing numbers have remained the same. Right. What they chose to staff on the operation schedule went down, but the number in the staffing table still remained that 144 field providers. And that's what I'm saying. And that number by the first of the year gets us hopefully back to where we were before they shut down Medic 24, Medic 43. So we could actually add 3 12-hour trucks without doing any reallocation of people.
Thank you, Chief. Chairman, that's all my questions.
Okay. Don't see any others. Okay. I've got a meeting I got to be at in 5 minutes, but go ahead.
Quick question.
Yes, sir.
A couple of years ago, a big issue that we had was frequent flyers, and they were driving up call volume. They were driving up cost. We weren't getting paid for those because they weren't covered with insurance and so forth. Where are we at with frequent flyers today? And is that causing us any issues? We have people 20 and 30 times a month we were transporting.
And we still have, and historically, since I've been here, we've had a few individuals that for whatever reason rely on EMS a lot. So we still have folks that call EMS as their first line of healthcare, and I don't believe that's going to change anytime soon. I mean, part of what we'd like to do is eventually get other resources out there besides sending an ambulance to some of these calls, the mobile integrated health. But like I said, that's a funding issue that we need to get to where that we can actually get funding for sending a paramedic, doing an evaluation, and then maybe finding other resources for them that's not a hospital, that may not be the most appropriate place for them to go to. So
well, we were working with Via Christi, and they were working a program to try and reduce the frequent flyers. That's all gone by the wayside, and there's nobody like Via Christi trying to help us.
No, and that was their that was a program that we partnered with Via Christi. It was more for their patients that were being dismissed that didn't, so they could not be readmitted, try to lower their readmission rates. There's some benefit to EMS on that, but there's other programs that are probably even more beneficial to EMS than that. So those are all things that we very much want to look at and very much want to move forward in the future doing.
Yeah, well, if it can reduce our call volume, you're having 20 plus calls a month for the same person. That is significant.
It is.
Thank you.
Could you touch very briefly, what percentage of your 70,000 calls are transports?
I believe last year we had roughly 44,000 calls last year were transport.
About 68.
Yeah.
Percent, somewhere in that range.
65% are transport.
65%. And so the other 35% are evaluate and leave them there, the refusals.
Mm-hmm.
You talk just very briefly, I know they're ready to go. Recently you've taken a spare paramedic when they didn't have a partner and put them in a vehicle. That's kind of a community paramedicine type situation.
We're kind of trying to touch on that. We instructed our district chiefs, if we have 2 people, of course, we're going to put them on an ambulance, but there are times where we have one person come, an odd person, that we can't put them on an ambulance and rather just put them third person on an ambulance. We've been putting them in a vehicle, and they would go out in the community, first respond on some of these lower acuity calls, freeze up the ambulance from responding. I don't have any data on that yet because we just started that recently, but I know talking to one of the individuals the other day that was doing that, he had ran 8 calls that day and had 7 patients that didn't want to go to the hospital, that an ambulance was never sent out. So that's part of one reason why we not only need ambulance, but staff vehicles, because we would like to do some of this to decrease the time we send ambulances out to calls that don't need ambulances, don't need the transport. And if they get there, and these are, like you said, through the dispatch pro QA or low acuity calls based on the information, and they go and assess. And if the ambulance is needed, if they want transported or need transported, they call out the transport.
A few questions on that, if you don't mind. The community paramedic, that one person in one vehicle?
Most models are. Yes.
Are there other models across the country that are using this that you can glean from? And
there's multiple other agencies that they're doing this.
And we've just started that, or
we're just starting kind of experimenting on when we have an extra person that we don't have a partner for them to get on an ambulance. So if we have another person, we much rather put them on an ambulance, but instead of them being third person or not having anywhere to go, we put them on there and are trying this out for.
I'll follow up with some.
And that's kind of what Commissioner Dennis was talking
Yeah.
about is
Mhm.
there are jurisdictions that they have, if they have the resources, they have community paramedics out there. And if you've got people who are frequently calling, but you know that they're going to be low acuity, they need referrals instead of going, you send that one paramedic, they go out, they figure out what they need, they stabilize them in place, they make referrals and they go on their way.
Okay.
You don't tie up an ambulance. And Via Christi funded something like that for heart patient releases so that they wouldn't get home and get scared and call for an ambulance to bring them right back to the hospital. There was lackluster support from the commission on that, and eventually Via Christi decided not to do it anymore, and so we got out of it.
Okay.
Commissioner Dennis.
Thank you. I want to go back to legislative issues real fast. Thank you.
Thank you.
I did looking at my emails and noticed that I got one from the zoo and they were trying to get zoo license plates. So I don't know what the next step is for us to be able to support them to get zoo license plates. If we can work that before the legislative session, does it have to be worked on in the legislative session or what's the next step? So they've got it designed, they're ready to go. They just need to know the next step.
Okay.
Thank you.
Typically that we've done that for a number of other things like Wichita Fund just did that. Other organizations I'm part of have done it. There's usually a upfront commitment that they have to have, and then there's costs that have to cover the state's portion of that. So it is usually a revenue generator for the organization. So that it is a good thing. But good topic. All right, thank you, Commissioner Dennis. Anything else? Chairman had to leave, I think. So looking around the room, manager, what else do we have to talk about today? You guys are easy. All right. Well, with that, we have a meeting tomorrow morning. Thanks everyone for your time today. We'll see you tomorrow.